Thank you, Mr. Speaker. Mr. Speaker, I just want to provide some updates from the Ministry of Health. And so, Mr. Speaker, we continue to work within the ministry to ensure that we improve the quality of care island-wide, as a matter of fact, statewide, meaning Grenada, Carriacou, and Petit Martinique. I just ended a visit to Carriacou and Petit Martinique yesterday, Mr. Speaker, just to get a first-hand view as to what has been happening there with the completion of the upgrades of the facilities. And we are happy to report, Mr. Speaker, that all of the facilities on the island of Carriacou has been complete to the level of 99.9%. So we are really there. On Carriacou also, Mr. Speaker, we are the proud recipient of laboratory outfit and clinic from Southcom, and we are in negotiations with them, Mr. Speaker, with the view of having the laboratory outfit or facility be relocated to the Princess Royal Hospital, because we believe, Mr. Speaker, the impact will be greater. It will be greater felt on that island, and the utility will be much better. And so, Mr. Speaker, we continue our dialogue with the view of being able to relocate that particular facility and bring, for the first time in the history of Carriacou and Petit Martinique, bring laboratory equipment and services to those beautiful islands. Mr. Speaker, I'm proud also to report the receipt of laparoscopic equipment and training from one Dr. Ducoin and family, who has seen it fit to assist us in that area as we continue, Mr. Speaker, to lobby strong with our partners in collaboration with the St. George's University and the South Florida University. Mr. Speaker, or University of South Florida proper. Mr. Speaker, this equipment is innovative because, to break it down, it allows the physician or the surgeon to be able to enter into the internal organs by way of only the equipment and the camera to be able to see what is going on and perform the surgery without cutting a big gap into the body. And Mr. Speaker, this is innovative for us. We have started that process some time ago with the assistance of Dr. McKinney, who has been doing so for most of the female or gynecology surgery. And so that has been happening, and the training continues with that also. So we are moving forward, Mr. Speaker. So laparoscopic surgery is also referred to as what we call keyhole surgery, in which you make a little incision into the body to perform major surgeries, and that is very innovative for us. So we continue to work in that area. Mr. Speaker, what does that do? This helps us in one, the patient will be able to heal much faster and be able to restore their health much faster. Additionally, ward time, bed nights on the ward will be significantly reduced. And so, Mr. Speaker, these are very important both for the patient as well as for the hospital management, because every night spent at the hospital requires output of staff, cleaning, laundry, medication, doctor and physician time, as the case may be. So it's meals and everything else that goes along with it. So there's a lot involved in the process, and so whatever we can do to minimize it and to create more space for incoming patients would certainly be a plus for us. And of course, it's faster than the open surgery. Mr. Speaker, mammogram equipment with biopsy capabilities has also been installed at the hospital. And that, again, is innovative and a first for us as we continue to improve services. So, Mr. Speaker, gradually, we are making some significant headways, and things are happening, things are changing on the ground as far as healthcare is concerned. In collaboration with the Mount Sinai International, Mr. Speaker, we continue to work on the 13 thematic areas to transform service at the hospital. And in particular, Mr. Speaker, the emergency department. We have done a lot of work there. We have done the gap analysis. And, Mr. Speaker, we're just doing the mapping to finalize, to determine how we're going to tweak the service to make it much faster, to create a faster turnover for patients as they come into the hospital. And so, Mr. Speaker, we continue to work with our team to ensure that that happens. As part of the whole change management exercise in collaboration with Mount Sinai and Project Polaris, Mr. Speaker, we will be hiring in some key personnel to assist and to lead the change management. So we'll be hiring in change managers. And one would understand, Mr. Speaker, that it is necessary to hire in international experts with great change management skills to lead this process. And so we will be, Mr. Speaker, in due course, hiring a CEO, a Director of Quality Improvements, Director of Human Resources, Chief Engineer, and a Chief Financial Officer or Financial Controller. And these are critical hires, Mr. Speaker, because these are the areas that is really going to lead the transformation in terms of the change management. We have wonderful clinicians, doctors and support staff and what have you, but, Mr. Speaker, But, Mr. Speaker, in terms of the governance and the change, in terms of the leadership, it is critical that we fill these gaps as we continue towards the statutoization. And, Mr. Speaker, speaking of that, following this sitting this morning, we will be having the statutoization transition team do a presentation here at the Parliament to involve the opposition and the upper house in that consultation, so that everyone would be brought up to speed as to what is happening as far as the statutoization is concerned. Mr. Speaker, we are going through every single parish, including our Sister Isles, to speak about statutoization, to hear from our people, to receive input into the framing of the policy and the subsequent legislation. And we consider this to be extremely important, Mr. Speaker. We did receive help from the Tony Blair Institute with the drafting of the policy and other local experts, of course. And so, Mr. Speaker, that has helped us immensely in terms of laying the foundation for what policy looks like. But going forward, Mr. Speaker, the input of the general population, they that receive the service at the operational level, it is important to hear from the general public and to include their contribution into the framing of the policy and the legislation. So we look forward and we encourage everyone, Mr. Speaker, to be part of that consultative process. Additionally, Mr. Speaker, this Friday, March 27th, 4 p.m., Calivini, there will be the sword turning for the new hospital. Project Polaris will be leading that, Mr. Speaker, and we welcome all and sundry to be part of it. We expect all of Grenada to come and to be part of the process. Mr. Speaker, this is transformative. This is the first time since the construction of, I would say, the international airport and SGU, This is the third largest investment on the state, within the state of Grenada. This is absolutely transformative, and we need all of Grenada to take a stake in their hospital, to take a stake in their own healthcare. And so, Mr. Speaker, this is only some of the heavy lifting that is happening right now at the hospital, at the Ministry of Health. Added to that, Mr. Speaker, I wouldn't go into it, but just to say that we continue the process of upgrading all of the health facilities around the country, right? And so there is going to be some inconvenience with service. Some of the services may have to be split up a bit into different areas to accommodate the renovations. And as we speak, Mr. Speaker, contracts are being signed, works are happening in